Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Hi, welcome to Health Impact. This is 5 good things. It's already that time of month. Just coming
Yes.
up, and here we are.
We get to talk about, and we are eternal optimists.
Yeah, it's getting harder and harder, but we did it once again. We figured out 5 good things. It's Megan Antonelli and Janae Sharp. Hi, Janae.
Hello, I'm thrilled to be here today for our 5 good things, not to be confused with 5 sarcastic things. But it's funny because this is a really good practice. It also makes you realize how a lot of the news coverage in healthcare is sad.
Well, we've had some great conversations today already during Health Impact, and I'm just excited. There's been so many as we're getting ready for Health Impact in June. Lots of making good connections with all the people and all the speakers who are coming. And we have an amazing faculty, and it's just been fun. It's fun to see healthcare have some energy again, although it does seem like there are 5 events a week. I went to ATA last week, which was amazing. It was so good to see everybody there. And then this week there's 3 events happening today, and everyone I've talked to has been at one of them. So it's busy time in healthcare, and there are some good things coming. Some of those things aren't necessarily health IT and digital. Some of them are broader than that. But what do you want to start with, Janae?
All right, let's start with something. Our event, first of all, is the ultimate good thing. So I get to see everybody next month. I love people. School will be out. Speaking of school, maybe our first good thing should be something that you suggested as a good thing. I'm still on the fence about updated nutritional standards in schools.
Yeah, no, I think it's a good thing because my child comes home every day having had chocolate milk, and I don't know why they would have chocolate milk at school. It doesn't seem healthy. It should not be part of anyone's regular daily, and it's whole milk. It is whole milk and it's chocolate. And so actually these standards from the Biden-Harris administration spell out a bunch of different nutritional things, but one of the major points of it is, I think, an elimination or limits of flavored milk, which I think is a really good thing because I don't think anybody needs flavored milk. Personally, I don't even like milk, so I don't want it ever.
Yeah, you don't like milk. You're not this audience. It reminds me.
I'm not going to be unhappy about it, but I do understand that lots of people need that milk provides a certain amount of nutrition and that it is fast nutrition for those who need it. But chocolate milk is not.
Right.
Putting sugar in milk is a unnecessary
It's a no-no.
treat.
It reminds me a couple of years ago, Sachin Jain posted about how he brought his own lunches. And I too brought my own lunches growing up, and I would trade them for Taco Bell and Nutty Bars. Actually, I have Nutty Bars with me right here. Every day I traded with one of my friends, and I think the guidelines are great, but there's always going to be some entrepreneurial, brought my homemade lunch from home with the cookies from my mom and traded them for all sorts of candy.
For sure. But if that mom, whoever that mom is, the cool moms that are giving them the fruit roll-ups and fun
Pop-Tarts?
Pop-Tarts.
I would trade a sandwich for a Pop-Tart flat across. Not now,
but the school does not need to be handing out chocolate milk. So I'm all for the nanny state of no chocolate milk in school. I'm all for it.
My kids for a while went to a school where they had a good salad bar. And it was the most groundbreaking thing ever because it was like better than any other salad bar I've seen.
Having grown up in New York and gone to public schools, but then to private school, I won't even talk about what my lunches were at private school because it's embarrassing. I don't think I've ate that well since. It was so good. And I can only imagine what they have now. There's probably full-on chefs and beyond omelet bars. Of course, they all had eating disorders on top of it. Hopefully it's not the same now, but I suspect
that line, eating disorder, healthy. There's a good way to do things and there's a wrong way to do things. So let's move on to the next good thing.
The next good thing, again, something that's near and dear to my heart, the discussion of menopause and hormone therapy. I think this has been a long time coming, and there's been a lot of debate around the WHI study and whether or not everything that came out of that was positive, and whether or not the risks associated with hormone therapy are, as bad as they say they are. And I think this study, which it says that the risk of the hormone therapy outweighs the benefits of it for many. Obviously, it's a personal choice. Of course, no matter where you are in that healthcare, you have to make those decisions. But I think it's what it shows to me, and why it's good news, is that they're looking at it and they're exploring it, and they're trying to do the right thing by women and study women's health and get the right path of treatment out there.
Yes. And in our previous good things, we talked about the Biden administration, like expanding funding for research about women's health. That news was interesting because I didn't know about the study in the first place. So I think it's good news to learn more about the advances that are happening in that space. Yeah. My next good thing, by the way, is about the House Ways and Means Committee potentially expanding. They marked up a bill about telehealth. During COVID-19, they expanded access to telemedicine and telehealth options for patients. So you could meet with people virtually. And it really changed a lot of healthcare delivery, good and bad. And they're looking at expanding that now. And people said, we want telemedicine. I loved it. I love being able to do it. If your kid needs an appointment, it's so fast, it's so easy. And then it's as soon as those there was a certain point when just like the offices were like, that's not happening anymore.
Yeah, so I know. It's amazing how quickly, efficiently, and telehealth provided the services when it was absolutely the only way. And the dangers of going into not good news territory. It has been a rough week or 2 weeks for the telehealth industry with the closure of Optum and Walmart. So I think the industry, and having gone to ATA last week and hearing the buzz and feeling what was going on there, this is really good news in that payment model. Even what we're seeing is that if an organization is just focused on telehealth, particularly in primary care, it's a really tough business model, right? If they're not making money from other more surgeries and everything else, the telehealth is a tough space to be in. The idea that it doesn't have a payment model, period, is really not good.
Shocking. So, it's shocking. And
because customers want it. The conversation we had today with Nzinga about if you give people what they want and they want it, then that's going to ultimately support the business models of hospitals and payers. Telehealth is that thing.
People want it. It's also a big question of access. And the Ways and Means Committee, when they were commenting on it, talked about how there are 600 rural hospitals in America that are on the brink of closure. And in many areas, if you call 911, you'll be waiting on hold for 30 minutes. So it's worse than your cable company. Mm-hmm. Pretty soon they'll turn into calling the IRS. Like they want to talk about it from the perspective of convenience, but also from the perspective of coverage. Like there are areas in the United States where we just don't have the specialists that people need, where people are dying sooner and earlier because they aren't able to take an entire day off of work to go to where a specialist is. So they delay getting care and they end up with worst care outcomes.
Yeah. And that's where, telemedicine started there, right? Telemedicine started to provide care to people who weren't in a hospital, right? On the battlefields and in rural and various communities around the United States. And it's interesting going to ATA, that's one of the large provider bases who attends that conference are still the battlefield folks that really were the founding fathers and mothers of this movement. And it is interesting to see where it's come. And now it's the mothers with children who really want it.
It's me. Like I want it. Yeah. I figured, yeah.
It's the
even with healthy kids, you're always at the doctor. Mm-hmm. Let's talk more about convenience, because our next good thing is about Geisinger. You know what? My kids went to Geisinger for a while. So, and
yeah, they had a recent, I think think I read about it on AMA. I'm not sure if they were a partner about it, but it was for like a health system.
AMA did a report specifically about the work that Geisinger has done to enable faster care or to transform that care experience. And
I think it goes back. So Bonnie Clipper at the ATA, I guess that's all I did last week was go to the ATA conference. But
it's almost like you went there.
Her talk was all about being a nurse. And, a lot of the conversations there were around virtual nursing. A lot of the technology there was around remote patient monitoring, and how the dialogue around AI for nurses is often focused on efficiency and staff reduction, and how no one has a problem talking about how AI is going to replace nurses, partially because the nurse staffing shortage is so bad. On the other hand, it seems for some reason to be less taboo than talking about replacing with physicians, where whenever we hear about AI, it's always, oh, it's a tool. It's never going to replace the doctor. It's never going to replace the connection. It's a tool. But for some reason, as she pointed out, even at booths and things around the hall, you could see that was not the sensitivity, or as much of a sensitivity, with nurses. And that, of course, it is. I think we talked about this a little bit the last time, that Kaiser and other nurses are going out and protesting, and it's the same type of challenges that the media, the writers, and the actors had. They want to be sure that they're not going to be replaced, but that it is going to augment. So what's nice about this study is that it is very focused on the augmentation of the physicians and their care teams, and giving them more time with patients, which is what we want to see.
Yes. And they said that they had saved over 500,000 hours through automation since 2019. Also, I think about BJ Moore and his discussions of what they did at Providence on our podcast. He mentioned that you'll be able to tell that those things are working for your organization, because when your nurses and physicians get something that makes their lives easier, they want it. They're going to demand that you have it. So that's such a great reminder to us that the people who are using it, the nurses, the clinicians, like, they'll let you know if the process of automation is working, and they'll let you know that it brings value to their lives. And that's also what the AMA found, that the satisfaction for employees, for people delivering care, goes way up. And that's really valuable for people. So that's great news. Happier healthcare workers, we'll take it.
Yeah, that's literally what you work on every day, isn't it, Janae?
Yes, I love it. I love happy people helping and healing.
Yeah. Then another good news was the HHS is announcing new funding opportunities for AI and behavioral health. So also intersecting with a lot of the work that the Sharp Index does, but this is more around building and learning models around IT adoption for behavioral health care providers, which is a great thing to see a focus on at the national level and the federal level, trying to drive the adoption of health IT and behavioral health, and encouraging that across the industry.
Yes. And some of that news is about the development of electronic health records and for an infrastructure for electronic health record data. And there's a huge gap at the point of care between people who come into the emergency room and getting that information back to a primary care physician or to their behavioral health support. And those gaps and those delays are responsible for catastrophic outcomes. So this bill would provide $20 million in funding starting in 2025 to look at some of that, improving clinical outcomes through better data. And if you've ever worked in health records, the behavioral health record realm, it seems just as separate as behavioral health is from health. So I love to see that coming together and becoming more integrated for everyone. I think once we have a more holistic view of people and the people that we're serving, including a holistic data perspective, we're going to see better outcomes as a society.
Right. Because mental health is health. And as you said, I mean, it's like we talk about things like food is medicine and exercise is medicine and behavioral health is health, but then we set up systems that don't connect those things. And the whole system, if you're a behavioral health provider, you're not looking at these things, and then therefore they don't get integrated in the same way, and they don't get looked at holistically, and then we end up in the mess that we're in. Being as positive as we can.
It is something to think about, because 80% of your health outcomes are going to be from things that are outside of the walls of healthcare. Most of it's going to be from your lifestyle. So access to data about that people are volunteering about mental health needs, but also needs like transportation or housing impacting health, that's critical for our public health infrastructure.
Mm-hmm.
And I think it's great news. The only bad thing is we need more funding. We're going to end up needing more. We've come a long way in the way that we talk about mental health and in the way that we approach it, including with data. And one of my last good things was one of our nominees for a Sharp Index Award. So we get to talk about people doing great work in mental health. I love doing that because mental health can be hard. Like when people are depressed, when people are sad, and some of the people who are working in that, you can really feel that they've carried each other's burdens, that they've helped other people, but that they don't always ask for recognition, but they could use it. Like the power that we have to support each other is huge, and it makes a big difference for those people who are responsible for it. And this year, we had a couple people that nominated our Surgeon General. And the reason I think this is good news and different news is that he's one of the first who's talked about loneliness and who's talked about the pandemic or the epidemic of loneliness, but also the horrible outcomes that are happening for healthcare providers. These things they've been happening for a while, but openly coming up with a plan and openly talking about it, especially in as the leader.
Has more. I always like the Surgeon General's role to highlight and bring to bear whatever the biggest healthcare challenge is. And of course, for him running through the pandemic, but that provider, the physician burnout, clinician burnout, and the mental health aspects of that. But then he really has focused a lot on loneliness and mental health in general, which you don't always think of as the Surgeon General's purview. But he has been very focused on that, which is great because it brings awareness to that.
Yeah, sure. And they've brought funding to veterans' health for mental health. I just think it has like profound implications for all of us that we've been able to have that focus on our humanity. Yes. And imagine if our healthcare was more about humanity. Amazing. And they talk about addiction, just like that focus as one of the nominees was one of my good news. Just hearing that, it brings a lot of hope,
Yeah, absolutely. Anything else good coming out of the Sharp Index Awards? Are you excited for
We have a lot of other things that are good that'll be a surprise. One of the things I thought was a big deal, I got to meet, he spoke at one of your events too, Dr. Jonathan DiPiero from Mount Sinai. They founded a center to support people's mental health through funding in New York, and they've held over 15,000 behavioral health visits. And I also didn't know he's an author. So I've been reading his book called Resilience, the Science of Mastering Life's Greatest Challenges. And as someone that, sometimes I feel like I am resilient, but I don't want to talk about that because like you get resilient through hardship. It was actually a really interesting book about the science behind that and how to do that. Like you don't have to go through trauma. It's not like the Misery Olympics. It's just about that science. And
that you can exercise your resilience without having to go through trauma.
Yes. So his work,
and therefore be prepared for when trauma inevitably comes. Being positive as we are.
And his work has done a lot to reduce workplace violence for healthcare workers and just to support and reduce suicides.
Yeah.
I never would have known about it without these awards. It's a giant program, but so I was really glad that those were two of the nominations that I thought were worth highlighting. And we will get to talk about more of them over the coming months and just celebrate some of that great work.
Watching you being part of the Sharp Index Awards has inspired us to launch the
Yes.
Health Impact Changemaker Awards this year, which is also a good thing. It's something we've always been talking about and thinking that we wanted to do.
It's like all of our favorite people, but who's the best of the favorite?
Right. I don't like to have favorites.
I do.
If it means that we get to give them awards and have them come up on stage, then maybe it's a good idea. So we've launched it this year, but basically by demand, because people wanted to see it happen, and because there's great things happening and people are doing wonderful things, and that's what we're here to do, is amplify that.
Yes.
We're excited. Nominations are open for a little while longer. Go to healthimpactforum.com to nominate your favorite healthcare worker. Are your nominations still open, Janae? I should know.
Yes, my nominations are still open until the end of this month. And I love that you're doing nominations. I think when I think about the health impact community, I really think about leaders who are dedicated to getting stuff done. And we can recognize who's great at that. These are people who have been dedicated to sharing their knowledge and to working with other people for years. So it's nice to have just a night where we celebrate them.
Doers, as they say.
Yes.
So
yes.
But yeah, no, it's an exciting partnership, and I am super excited to see it come to life in June, which will be here before we know it.
Yes. So go nominate people. It'll be powerful, I think.
Yes. So that's a lot of good things this month so far. There's some funding coming to behavioral health. There are some positive measurable outcomes around automation and care hours and time, and freeing up those physicians, clinicians' work time and giving them more time with their patients. Some news on the menopause front, which is my favorite. Give me
the
those hormones. Give me whatever you got.
I'm not going through menopause yet, but like I've had the conversation.
Chocolate milk. Just take it away. No more chocolate milk, but give me my estrogen.
That's very quotable.
Thank you, everybody, for joining us. Until next time, it's Megan Antonelli and Janae Sharp. Talk to you soon.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.